everyone, welcome to today's Health Career Super Fair, and particular to the Nursing and Midwifery Focus Session. My name is Phil, and I'm from a company called Prospel, and we're really helping just to put on today's event. Now, before I proceed, I'd like to begin by acknowledging the traditional owners of the land on which we meet today. I'd also like to pay my respects to elders past and present and emerging. Now, what I'd like to do, I've got the pleasure today of actually introducing a couple of our panel speakers today. So first off, we've got Kim and Peter from Ramsay Healthcare. And then we also have Nicole from Gold Coast Hospital and Health Service. So what I'm going to do is I'm going to make sure you can see all of us here. There we go, it's working now. Perfect. And what I would like to do is I've got a couple of questions that I'm going to fire away at these lovely women. And if at any point anyone has any questions or anything they would like to ask, please feel free to use the Q&A box. It is easier. Obviously, the chat section is great, but if you do have any questions that you would like me to go through, if I've got time at the end, I'm going to sort of filter through those and ask any ones which I feel sort of relevant. But first off, might start with Kim and Peter. If one of you would just like to give us a bit of an introduction into sort of who you are. Might start with yourself, Kim, seeing you're on here first, and then I'll get sort of Peter to continue. But sort of who you are, a little bit about Ramsay Healthcare, and yeah, go for gold.
Okay, so my name's Kim Lally. I am the New South Wales Workforce Programs Coordinator. Basically, I look after workforce program portfolios, so students, graduates, and a little bit of an education focus. I work for Ramsay Healthcare, which is the largest provider of private healthcare in Australia, and it's one of the top 3 in the world. We have over 500 facilities across 11 countries, so we're a big global operation now, considering that we started from very humble beginnings by a gentleman named Paul Ramsay, who was an Australian, and he launched his very first hospital on the Northern Beaches in Sydney, or in North Sydney, in 1964, I think it was. So yeah, very exciting to be here. Welcome.
Awesome. Thanks for that, Kim. And Peter, obviously you're from Ramsay Healthcare as well. Do you just give just a brief introduction as well?
Sure thing. So my name's Peter Kirk-Lawrence, and I'm actually the education coordinator for a network of hospitals in Sydney called the North Shore Network. And the North Shore Network encompasses North Shore Private Hospital, Castle Crag Private Hospital, and Hunters Hill Private Hospital. So I work quite closely with Kim because she's across the road in our head office. And my portfolio, while being the education coordinator across the 3 sites, encompasses undergraduate students as well. So we really foster growing our own within Ramsay. Yeah, it's a lovely place to work, and I hope we are able to give you guys all the information that you'd like to hear today.
Awesome. Thanks Peter. Phil. Awesome. And last but definitely not least, Nicole.
Thank you, Phil. Hi, everyone. My name's Nicole Graham, and I'm the Assistant Director of Nursing for Mental Health and Specialist Services. My portfolio is education. I work very closely with the rest of the hospital, but particularly our entry practice team, who support all of our new graduates across both enrolled nurses and registered nurses and midwifery. We're one of Queensland's largest clinical teaching and research tertiary hospitals. We are the first magnet designated health service within Australia. We have 1,114 beds across 2 campuses, and we're in the current plans for a 3rd satellite hospital in Southern Gold Coast, which is exciting. And we provide extensive community services. And like Peter and Kim were saying, we hope to also provide you with all the information that you need today to make a very informed choice about your future. So welcome.
Beautiful. Awesome. How good is that background, everyone? We were having a chat about this beforehand. It's like just out in the park, no one really around. Awesome. Thanks, Kim. Thanks, Nicole. Now, a question which I've got, I might actually start with yourself, Kim, and then we'll sort of go around. But the first question that I would like to ask is, in terms of I guess, the most important piece of advice that you'd actually like to give to students aspiring to work, obviously for your organization, but just, I guess, just in general, like just for that, for that sector, what would be like the most important piece of advice that you would give to students that are aspiring to work in that sector?
Just be the best you that you can be. So don't try and be anybody else. Put your best foot forward and always be authentic and realistic. I often see a lot of people trying to be someone else or emulate someone else, when really we just want people to show us who they really are, because chances are it's the real you that we really want, not the you that you think we might want. Don't ever try and anticipate what we're looking for, because you'll never be able to guess, basically, because sometimes we don't know until we actually see it. So it's really important just to be the best, the best person that you can be.
Yeah, just be genuine, authentic. It's good advice. I like it. How about yourself, Peter?
Well, Kim's stolen my answer there, because I was
stolen your thunder.
That's a really big thing, particularly for me. I've been interviewing graduates for a decade. And so I always sort of say, I just want to see someone who's authentic. But I suppose if I could give a little piece of advice for those who transition to practice once they have their registration is, the best piece of advice I could probably give is to say it's totally normal to have ups and downs. It will be tough. And if you're having a really tough day, a tough week, or a tough month, that is totally normal. So I suppose that's just what I really wanted to say. It's very normal. There's this honeymoon phase in the first few months that I always see with our graduates, and they think they're doing they're going swimmingly. And I can see Nicole nodding there, because it's this great honeymoon period. And I always say to my graduates, when you call to see me at 12 weeks, I'll have the box of tissues ready, okay? Because it's usually around the 12-week mark. But I suppose the most important thing really is just to acknowledge that that is normal and it is expected. And for graduates, I always sort of say, you know what, graduates have expectations of themselves that they expect they'll be performing here. And my expectations are really here. I find that people always expect that they should be somewhere else or performing to a different standard. I think we always put a lot of pressure on ourselves. So that would be my advice.
Yeah, totally. Yeah, you're 100% right. We always try to compare sometimes our worst qualities as somebody else's best. It's like, I haven't actually worked in this sector for, 10 years, or maybe somebody else has worked over 10 years and I'm just starting. It's like, that's a very unfair comparison. We shouldn't be doing that. The only person we can really compare is who we are today, and maybe, trying to improve each day.
That's exactly correct. And you know what? Nursing is a fairly honest industry. You will always get honest feedback on your performance. Okay, so just take your feedback and just move forward with it.
Yeah, perfect. Thank you for that. Nicole, same question. What would be the best bit of advice that you could give to a student thinking about sort of getting into sort of nursing and midwifery?
So I think Kim and Peter really wrapped up the nice things around that. But I think people should really look at where they're applying and what the hospital or organisation values are. And then ask yourself, do you actually fit with those values? And then reflect on how you would align to that organisation's values. And I think that, when I'm employing, and I know for our health service, our values mean everything to us. So you can't fake those. You are either that type of person and you align well to those, and you've had some really considerable thought about it. I think then you'll do yourself justice. And I think that you'll merge into that organisation a lot easier than if you hadn't.
Yep, totally. Perfect. Thank you for that. It sort of leads into my next question as well, actually. And the question is, like, in terms of what you're sort of looking for when students are applying, like what is it? What are like some of the key aspects which you as an organization are looking for? Like what do students really need to show to actually progress to the next round? And I might direct that conversation, you might go around a bit of a circle. Kim, if you'd like to have an answer of that one.
Certainly. Again, we're looking for authentic people who are representing who they truly are, but they know which facility they're applying to and what is involved at that facility. Particularly working in private healthcare organisation, we really want people to understand what private healthcare is all about, and that we have a truly symbiotic relationship with the public system. It's not us and them, it is we're all healthcare staff and we're all working together. And I think for me, that's the biggest thing. I often see people go, oh, public or the private, but it's not. We're all nurses or we're all midwives, and it's really important to make sure that everyone appreciates that we have the same skills, we're looking at the same things. But really, it's very much along the lines of what Nicole's just said. You need to know that you're going to fit in with the culture and the environment that you're applying to. But most importantly, you actually know why you want to work for us and why you think that we are the best employer for you. So what does the hospital you're applying to have to offer you? You know, there's no point applying to, say, North Shore Private if you want to do mental health, because they don't offer mental health. You need to look at one of the other facilities. So that's kind of my biggest thing. Be very aware of what you're applying to and make sure that you target your application and your interviews around that, and do your research really well.
It's really good advice. Yeah, find out, you know, what type of, really obviously the sector is important, but also like what type of hospital am I wanting to really work at. So awesome advice. I'll pass the baton on to Peter.
So probably Kim and I have obviously been working together for quite a while, and we do careers fairs together. So obviously what Kim says, I feel, you know,
I'll just echo what she says.
I'll echo what she says, exactly. But I suppose the other thing for me, because I recruit for 3 hospitals, is exactly what Nicole and Kim have already said. I want to know that it's someone who wants to work in our organisation, and obviously that they'll fit the culture of the hospital. But the other things that I suppose, if I'm going to give some really practical advice so that I could just build on what Kim has said, you know, for me as a recruiter, and, you know, Nicole might be different at Gold Coast, and she might comment on this, but, you know, I'm looking for the right attitudes and behaviours. I'm not necessarily looking at your marks, and that's not to say you shouldn't study really hard, and it is fantastic if you get distinctions and high distinctions and graduate with an honours. That's fantastic. But I'm not looking at that, because at the end of the day, you've all got the same qualifications. I'm looking for the right attitudes and behaviours. And I want to know, are you willing to learn? Are you teachable? Will you fit our culture? Then the other thing, just going back to real basics, is just from the get-go when you're applying, it's that attention to detail. And when I get a CV or if I get a cover letter that's addressed to Mr. Clark from Liverpool Public Hospital, that person will automatically go into a no pile, because I don't have time to, you know, it's such a competitive process that when I've got hundreds of CVs and cover letters to review, then that person, they don't, that it comes across to me as though they don't value our organisation, and they're just sort of, you know, trying not to put all their eggs in one basket. So it's just that attention to detail, and also just the interview process as well, making sure that you dress appropriately, and body language, and your appearance, because we know that those first few minutes we instantly form opinions about the candidate. So I suppose then I could just elaborating with some practical advice, I suppose.
What would you recommend in terms of, I know it's a very broad topic, but in terms of like dress code for interviews, what are your expectations? Like obviously for a guy, is it a full suit, or are you just talking a business attire? Like what is the expectation there?
Look, you know what, I just think as long as it's smart, no jeans. I have honestly had a graduate turn up in tracksuit pants and trainers. But if you turn up in a suit, if you're a bloke and you turn up in a suit, then we will think the world of you. But if you turn up in business pants and you know, a business shirt similar to what you've got going on, Phil, but I don't know if you're casual down the bottom at the moment.
You don't want to know. No, I was kidding.
But, you know, button-up shirts, and ladies, you know, and, you know, just so that you look, you know, that you look professional, I suppose, and paying attention to hair and jewelry and making sure your shoes are polished and don't have, it really does come down to that sort of stuff.
Just going the extra mile is really what you're saying,
it,
standing
exactly.
out.
Yeah,
in a good way.
And just showing that you're making an effort and that you really want to impress us.
Totally. Awesome.
Yeah.
Thank you for that, Peter. And Nicole, I'll ask the question again. So for students who, I guess, wanting to land a job with you, actually, I might sort of shift the question, if you don't mind. For students who are wanting to land a job with you, what advice would you give them to actually help them survive and really thrive in their first year? Like what shouldn't they do?
Shouldn't be too hard on themselves. And I think that leads in with what Kim and Peter were talking about earlier around, the expectations of oneself. You can't compare yourself to somebody who has had many years clinical practice. And I don't think that that's healthy anyway, because you want to become the best you that you can be. So I think believing in yourself and being very kind to yourself, participating in self-care activities, and that could be mindfulness, making sure that you're connecting with your family and friends, taking that time out when you've got time off, not picking up too many overtime shifts or, working additional hours, not working 2 jobs at once, those practical applications. Recognise that it's a learning and development opportunity. So nursing or midwifery is a very long career, and there's so much opportunity for growth and movement. So where you start in your first year, don't think that that will be the last place you go. So I always have a mantra that 5 years is a very long time, and literature supports that as well, that you should be looking to move and progress. So I think look for those learning and development opportunities. Don't be too hard on yourself. If you don't get the perfect graduate program, if you don't get ED in this fast-paced environment and you get an offer for rehabilitation, take it and embrace it. So I think that's how you do survive, because that's just a platform to get you started. Ask lots of questions, engage in every learning opportunity that you can. Actively reflect on your practice and seek feedback from your peers, your managers, but more importantly, from your patients and their carers and loved ones. That's where the true feedback comes from. So don't forget to ask them if you've given them the gold class standard of care that they deserve.
That's really good. Always, like what you said as well, like always be asking questions, always be, open to feedback. And hey, look, sometimes criticism, because that's honestly where we get a lot of personal growth and even, career growth. Because sometimes when people give us advice or criticism, we don't want to hear it. But inevitably, those crucial conversations and confrontations that we have by far is where we get the most amount of growth from. So I appreciate you sharing.
And sorry, just to add to that, I think that if you don't get some constructive criticism, I think you're not asking the right questions. So it's go back to getting the truth, because you want to grow. You can't be perfect and glowing in your first year. Take it from me, who, graduated many moons ago. I just got positive feedback, and it actually didn't mean a lot to me in the end. It was lovely to hear.
It's always good to hear, isn't it? I'm doing great.
lovely and gentle and warm and caring. However, somebody senior to me said, you're not asking the right questions if that's all you're getting.
Yeah, that's powerful. It's very powerful. I might sort of stick with that question. Kim, if you'd like to have a try of answering. The question was, just to remind, for students who land a job with you, what advice would you give them to really survive and thrive in their first year? Things they should do, things they should maybe stay away from.
Very similar to what Nicole said. We all seem to think very similarly, and it's not surprising because it's kind of the role that we're all in. And again, I would really want to mirror, make sure they ask lots of questions and try and find the right question. If you're not getting the answer that you want or the answer that you need, put the question to the person in a different way and look at reframing it and trying to get the best feedback that you can get that'll actually help you grow. As Nicole said, it's lovely to hear wonderful feedback about how fantastically you're doing, but you don't grow if you don't find those areas that you really need to work that little bit extra on. I guess it's about also really talking and being resilient. So if you encounter an issue, because let's face it, healthcare can be quite a challenging environment to work in. And if you encounter an issue, whether it may be a bit of a disagreement with a colleague, or if you have trouble with a difficult patient, or whatever it might be, it's really important to talk your issues through and not hold on to them. Issues start to happen when particularly new practitioners don't want to admit that they're struggling with something, or don't want to admit that they need assistance with something. And that's where you'll fall down. Be very upfront and say, you know what, I had this issue the other day. Mr. Brown wanted me to do X, Y, Z. I didn't think it was appropriate. I answered with this and he got really upset. You know, what actions could have taken, or did I handle this situation okay? And just get the opportunity to talk it out. And as kind of frivolous as it sounds, it's actually, talk isn't cheap. Talk is really, really important to be able to work through any issues that you have to prevent them from becoming mental health problems. So that would be my biggest tip, is to really look after yourself and talk your issues through to help with your resilience.
Yeah, there's a lot of people who, you can talk to about that sort of stuff. Sometimes it just helps really get it out. Up here is a bit of a maze, bit of a mind. Anyway, it's not a very complex place. So once we can get it out and actually put into the physical world, it can really help. Totally.
Absolutely. And we don't know if there's a problem if you're not talking to us, because none of us passed our mind reading course. We're not particularly good at that. So
no, neither did I. I wish I did that. Life would be so much easier. It'd be great. If anyone works out a way, please let me know. For Peter, I might change the question, because I feel like you're probably going to be on the same page as well. If a student is looking, and let's say they're studying at the moment, they're sort of like, I don't know if I want to work. They keep getting asked the question, you're going to go into the private sector or you're going to go into the public sector? And they're just not too sure yet. What do you think are some important points which students should know about each, so they can make a healthy decision about sort of which direction they're going to go in?
Yeah, so that's a really good question. And I suppose, all of us in the private sector, we've been in the public, we've worked public. And I suppose a really important thing to know is there's just as many opportunities in the private sector. We still have patients, we still have nurses, we still have doctors, we still have patients with comorbidities, we still deliver babies, we still do, operations. Quite a few of the private hospitals have emergency departments. So look, I really don't think there's, at the end of the day, we're still just people caring for people. And that's actually Ramsay's motto, which is people caring for people. And that's what we're doing regardless of the facility that we're at. Kim, did you want to elaborate on anything that I said there?
No, not really. I agree completely. And I think it's just important to remember that you're not just going into the public or the private, as I mentioned earlier. You're going into healthcare. We're all one big family that actually does need to work together. We need to send patients to the public system. The public system need to send patients to us a lot of the time. And the public system on its own couldn't cope without the private system in place. They would just collapse under the strain. So the private system actually do between 1/3 to 2/3 of all elective surgeries within Australia. So we do a huge amount to keep our health system going, because it is a health system. It's not two separate systems running together. We work very symbiotically.
And Nicole might be able to just elaborate on this, but a couple of years ago, Kim and I had a student that said to us, I've heard if I do my grad program in the private sector, I will never get a job in the public sector. Well, you know what? If you're a nurse or a midwife who's got more than 1 or 2 years experience and a grad program under your belt, I guarantee you the public sector will snap you up in a second. Am I correct, Nicole?
Absolutely correct. We truly value people who have done their first year within a private sector. It is one profession, and we do work very closely together. We have those relationships, and I think as you would value somebody who's done the graduate program in our public sector.
Yeah,
exactly.
Absolutely.
And just you know, talking on, you know, how closely the hospitals work, you know, and in Sydney, and as happens on the Gold Coast as well, you know, there's a lot of shared campuses. So at the moment, I'm at North Shore Private Hospital, which is on the campus of Royal North Shore, and our cath lab is actually situated in the you know, in the building, in the premise of Royal North Shore Hospital. So there is a lot of collaboration between the two hospitals. And yeah. Sorry, Phil, we kind of took that away from you.
No, I love it. Go for it. Go for gold. You know, I'm not the expert here. I just want to ask questions. I've got 2 more questions. I was going through the questions that a few of the students wanting to know, and they were asking a lot about international students. Is there international programs available? If I'm an international student, is there anything I should be looking out for? How can I make sure my application stands out? So I don't really have anyone to throw to, but if anyone wants to have a shot at that question, whoever you feel like, yeah, if anyone wants to take the role or try to answer that one, give some students some clarification.
I feel really bad. Like, I'm happy to answer it, but I feel bad because I keep going first. Nicole, did you want to go first?
Yeah, Kim.
No, you can take this away, Kim. You can go first. I'll follow on.
I'll ask you one after, Nicole. It's fine. Make sure it's even.
Look, we certainly do take international students, but it's very, very, very important to note. We need to know that you are going to register at the end and that you are going to be able to work for us. So we need to know that you're going to pass, or you have passed, your English language requirements, and that you know what your visa requirements are and you're well underway towards working towards them. So for instance, do you qualify for permanent residency? If you do qualify for permanent residency, do you have to leave, physically leave the country for your permanent residency to come in, you know, after the bridging? If you qualify for a skilled graduate visa, do you know what your point mark is for your skilled graduate visa? Do you have to go to regional? Are you able to stay in a metropolitan area? So we need to know that you need to know what you need to do, but that you're actually got it all under control. So you are going through the visa process, so you are going through the PR process. This is where you're up to. This is what you've done. These are the steps that you need to go through. So the possibility is absolutely there, but we need to know that we're not going to all the effort to recruit you and get really excited because you're coming on board with us, but then you don't meet the requirements. And you know, we don't have you, but we also don't have the other people that we turned away because we thought we were going to have you. So it's really, really important for us to make sure that if you do progress to that point, that you have all of your ducks in a row and you're very transparent with that process.
Good answer. Thank you for that. Now we've only got 1 minute, so what I'm going to do is do a rapid fire round. Same question for everyone, but in one sentence, if you could give us just one reason, one sentence as to why students would want to work for your organization. Let's go, Nicole. Let's start with Nicole, and then we'll go to Peter, then to Kim. Let's go. We'll reverse it back. Go for it, Nicole.
We are committed to supporting the newly qualified nurse or midwife. We have a great sense of community, and our mantra is always care.
Awesome. Thanks, Nicole. Peter?
Yeah, so I just sort of thought, look, I always say to graduates and to students, if you want a really supportive environment where you feel like you're part of a family, then Ramsay is that place, as evidenced by Kim and I, who have worked for Ramsay for a very long time. We won't tell you how long, but yeah, because it's like being part of a big family.
Awesome. Beautiful. Kim?
And mine is just, we truly are people caring for people. So if that's what you're looking for, where we need to be.
Awesome. Beautiful. Well, look, thank you so much for coming on. I really feel like a lot of students will get a lot of value from this. I highly recommend anyone that's tuned in. There's a ton of questions here. So honestly, after this, the booth should be open now. So what I recommend doing, jump in these lovely women's booths and have a chat to them, ask the questions, and ask as many questions as you can, as I think Nicole was saying. So ask the questions, and we'll thank you again for coming on, girls. I do appreciate it.